standing in Nyabisindu, and it's a small community that is just about maybe a 10 or 15 minute walk from where the church is. I'm a midwife, and I've been working in the developing world now for about 4.5 years, and we've been in Rwanda for the last 2.5. So we are basically marooned on an island on a hill that's in the middle of Kigali, and this hill has just really a lot of people that are either digging gardens for their living, or they're daily labor workers, or they might be house help for some of the families that are in Kigali. And we came here because we really felt like God had a call on us to be among the poorest of the poor here, and we really wanted to see God's kingdom established in this area. We're completely surrounded by wealthier neighborhoods, and this is the area that's known for crime and for just for a poor standard of living. Rwanda, out of all of sub-Saharan Africa, Rwanda still has one of the worst maternal and infant mortality rates in sub-Saharan Africa. The only countries that are higher, with higher rates, are countries that are currently experiencing civil war. So we have a lifetime risk of a mom dying, 1 in 16. In Canada, it's 1 in 100,000. With babies, we're losing our babies 1 in 5 before the age of 5, and most of those are in the first week of life. And there's something really wrong about that, and I believe that God's heart breaks when he sees this happening. And most of these causes are preventable causes, so we need to bring solutions not only from what we know medically, but spiritually as well. We started coming in this community about 2 years ago, and we were prayer walking here and asking God, what could we do in this community? What was he already at work doing, and how could we join him? One of the hardest things has been that church is over there for the rich people, but what do we have here for the people that are living in urban poverty? And what is the connection? Where's the body of Christ? If one part of the body is hurting, why aren't we here? In this community, there's a lot of needs, a lot of kids that are sick with recurrent disease, and moms and babies that need some help. So we thought we would start praying about how we could implement community health evangelism, which is the marrying of a physical ministry and a spiritual ministry, just like Jesus did when he was in ministry on earth. At first it was difficult because people were expecting handouts, and community health evangelism is not about that. It's about helping local people find local issues and addressing those issues with local resources, and with the help of the community addressing things. So it's not about pouring money into this area. It's about really finding what do we have already here that we can use to meet needs. We originally came to partner with CLA to build the Health and Wellness Center, which is aimed at reaching people like people who are living here, with not only physical help but also spiritual support. So when we first came, that was the reason why we came, but we very closely became aware that there was a lot that needed to happen here preventative-wise until that clinic is built, and we can focus a little bit more on providing care for people who are in desperate need for delivery services and for care for their children. We're finishing pouring the second floor slab at the clinic. We've used up the 100,000 that we've had to start off with, and it's been really exciting to see how far God has stretched that money. We've gotten a lot more accomplished than we thought we were going to be able to with that money. So we have basically the ground floor, the first slab, and we're looking at putting the ring beam on and the roof with this money, and then we're going to see what God does, because we want to be able to finish this off and be able to get in there as soon as possible. The Health and Wellness Center, the vision is to basically provide care for people who need it most, good quality, compassionate care for the people of Kigali, and especially for the people of Nyabisindu. And we're passionate about doing that. we see behind us is a church plant that has come out of community health evangelism. We had several outreaches here involving reproductive health and malaria education and diarrhea education and colds and coughs and pneumonia. And then out of that, there was a group of people that asked, could we meet together and pray together? And this church plant in Nyabisindu came about through that. We get to be a part of what God's doing here, and it's very exciting what He's doing, how He's working among people in Rwanda for reconciliation, how He's working to improve health, how He's working to reconcile people to Him, and we get to be a part of that, and that is so exciting. We're looking forward to the future. We're so thankful for God's provision up to this point, and we are so looking forward to what He's going to do through the Health and Wellness Center to bless people in this community and to help reach the rest of this city of Kigali for Him.